Dr. Rosenthal, thank you so much for joining me today. It's a great pleasure to talk to you about a topic which is clearly near and dear to both of us. Obesity and its ramifications just beyond obesity. And tell me a little bit more about yourself. How did you get here? How did you get into this area? How did your passion develop?
Thank you, Rasi, and thank you for having me. It's a privilege to be part of this podcast. Well, my journey started a long time ago in Argentina, where I grew up as a son of refugees from the Second World War. I became a doctor and decided then to immigrate back to Germany, where my family was originally from. So I did my first residency in surgery after my medical studies in Argentina. And once I got to Germany, I had to redo my school of medicine and redo my residency in surgery. Spent 10 years in Germany, and I never ever thought about the obesity disease, or I've never seen a case of bariatric surgery. And then I decided to come to the United States of America. I was given an opportunity to go to UCLA, Cedars-Sinai in Los Angeles.
Hmm,
And that was 1993 as a fellow. I was the first fellow in minimally invasive surgery in the United States of America,
that's
uh,
interesting. Okay.
industry sponsored.
Okay.
And I started doing minimally invasive surgery, and then I decided to stay in this country. So I went for my third residency, this time in English, not in German, not in Spanish. I had two little kids, and we decided to stay in America. So that I did at Mount Sinai, New York. And my first rotation at Mount Sinai, New York, was with a surgeon named Peter Benotti. And Peter is a bariatric surgeon par excellence, now retired, still an avid publisher. And yeah, that was the first time I saw a bariatric case, and I started thinking about obesity being a disease. And I think the rest is history. I became passionate about the technicality of the operation. At that time, we did operations that we don't do any longer, but they were fun. They were all open.
Hmm.
And came across a surgeon named Michel Garnier while I was at Mount Sinai, New York, a pioneer in minimally invasive and bariatric surgery. And well, I had an opportunity to come to Miami, Florida, to literally start the Cleveland Clinic, Florida, and that's been 25 years that I enjoyed being here and developed the Bariatric Institute and participate in not only the evolution of bariatric surgery, but I've seen so many things come across my desk, from open to laparoscopy, from VBGs to gastric bypasses to bands to sleeve gastrectomies. And needless to say, now we are living the revolution of the GLP-1 of medications, which I think it's fantastic. It's great for humanity. And that's how I got here. And I've been here in Florida for the last 25 years.
So you're not bilingual, but trilingual, I guess.
Yeah,
Spanish, Germany, and English.
yeah, that's correct.
And that's awesome. That's fantastic. You've had so many publications, so many publications. I took a long time to just go through the whole list of them. But I was very surprised by how you look at obesity beyond just the number on the scale, but you look at obesity as a metabolic disease, and you look at obesity as an associated or a risk factor for cancer. Can you kind of expand on that, please?
Yeah, as it should be, we teach our residents and fellows, but we should always keep our ears and minds open to learn from them as well. I have to tell you that in our research meetings, one of my fellows that recently graduated as a surgical resident said to me, Dr. Rosedal, I came across this article, and it was a report from the CDC from 2017 looking at obesity in America, the 10-year review to see what the link was between the obesity disease and cancer. So we went over that article, and I was really shocked that nobody really that should have made it to CNN or Fox News, just to be politically correct. I'd rather have it published in CNN first. So, long story short, that article was telling you that 55% of cancers diagnosed in postmenopausal women, 55% are linked to the obesity disease. I couldn't believe how the news did not publish something like that and made the world aware of such a
Hmm.
significant correlation between obesity and cancer. Because, with obesity, people live with, doesn't hurt. They can live for decades being obese. Unfortunately, people see it sometimes as a reason to laugh and it's funny. But in reality, those who are obese, to your point, have so many medical problems that are linked to it, from diabetes, hypertension, sleep apnea, osteoarthritis, stroke, heart attacks. But cancer? So a physician named Ted Adams from the University of Utah did a very interesting study also that I read, triggered by that CDC study. And he looked at the mortality of obese subjects that underwent bariatric surgery and the mortality of those who did not. And the
Hmm.
numbers were staggering because he took the DMV, people that went to get their DMV, and matched those who were obese and did not have bariatric surgery and those who were obese and did have a gastric bypass. And significantly higher mortality in obese subjects that did not have bariatric surgery. But the number one reason why those people died were not heart attacks, strokes, it was cancer. So it kind of started correlating one thing with the other. And I started taking a deeper dive into the literature. And there is also a researcher, a scientist named Moore, who looked at the correlation of obesity, diabetes, and cancer. So, following the CDC numbers, if you are obese and you are a female, the likelihood of you developing cancer and you're a postmenopausal female is close to 50% or larger. If you're obese and diabetic, the chances increase by 200%.
Oh my God. So it's a sure shot then.
I mean, kind of, how come that we in the era, Raz, in the era of population health, in the era of preventive medicine, we should not be operating on anyone. Everyone should be on GLP. It should be sublingual. You should brush your teeth every morning and take one of those GLPs so that you are not hungry and you don't become obese. But how come we don't make people aware? That's why I'm so passionate to be on this kind of
Absolutely.
public programs where people can, I mean, the numbers are staggering.
I mean, it is still, to your point, that was the main reason. It was, yes, I'm an interventional cardiologist. I see the other end of the spectrum, right, where I'm putting stents. I'm like, yes, I'm putting stents, I'm doing that. But we have to fix the root cause here. And obesity it's just not about, oh, you're this pant size or this dress size. It's a disease, and people have gotten so comfortable. We have somehow normalized a disease in the name of acceptance or whatever. We have normalized the disease. If all of us walked around with a bacterial infection on our face, that would not be socially acceptable. So we have normalized the disease, and we have made people saying it's okay to not take treatment or do whatever you need to do to get past this. I think that's extremely unfortunate. And I think we've lost empathy towards how big this problem is.
I can't agree more with you, Arasi, but let me tell you that the ignorance about the implications of our bodies storing fat and the implications that it has to our health, the ignorance comes from all different levels. It's not only the population, the lay public.
Mhm.
It is also physicians. I was given 10 minutes to present about this at the American Society of Metabolic and Bariatric Surgery this year, and the audience was packed with leaders. And immediately I got invitations to present in the most prestigious universities in America to give surgical grand rounds. And what was telling me is these guys just woke up, and these are
Yes.
the leaders of bariatric surgery in the world. So
Mhm.
I'm honored and grateful to be invited. But on the other side is this really news to you? You should be so familiar with these numbers.
Mhm.
And I think we as a society and as physicians, cardiologists, primary care physicians, should be really every single day preaching to the choir and telling our patients, telling our politicians how serious this is. That's why I believe that GLP-1 agonists are a blessing to humankind. And unfortunately, they're still too expensive. But I do believe that as they are going to get cheaper and cheaper and easier to administer, there's not going to be an injection. People are going to start using it more liberally. And they say, well, but you are not morbidly obese. Your BMI is not 30. Well, BMI
Yes.
of 28 is overweight. We really don't know yet the science of what are the implications of being 20 pounds or 15 pounds heavier than what we should be.
But like even in the, we let's talk about patients who have severe disease, severe obesity, like 300 pounders and 400 pounders, etc. Do you think GLP-1 will make enough of an impact to reduce cancer incidence in them?
You're making a great, great point, and I tell you why. Obviously, as a bariatric surgeon, I would like to defend my business, and I don't want to stop operating because of these medications. But as a doctor and as an individual, I always say a good surgeon doesn't operate. The truth to the matter is that studies coming from the Kaiser Permanente group and also coming from the Cleveland Clinic that I'm privileged to work for, the Kaiser Permanente group, the first author was Dr. Shower, not Phil Shower, another Shower, who is not a surgeon. And for the Cleveland Clinic, the first author was Dr. Aminian. And I'm saying this name so that people can fact check me. Those studies have shown that if you want to get the most protection against cancer linked to obesity, you need to lose at least 30% of your excess body weight. So far, the GLP-1s don't make it through the finish line. Now,
Okay.
I'm not saying that when patients come to the office that are severely obese and are asking for treatment modalities, we should immediately say, well, you'll never make it to 30% excess body weight loss with medication. You should have surgery. I'm not saying that because, in all honesty, we are operating on less than 1% of the affected population. And while the theory or the hypothesis has been that the reason we operate on so few of those affected by obesity was fear or the lack of insurance. And we did a study and we published it in SWORD, which is the number one journal on bariatric and obesity in the world. We did a study of 100 individuals that came to the clinic, severely obese, hypertension, diabetes, and everything. And we said, why didn't you get bariatric surgery? Did you consider that? Hypothesis was fear, lack of insurance. The number one reason was denial.
By the insurance companies.
To the point you made, 2 points that you made that are very well taken. One is that losing weight, losing some weight, is not good enough. You need to lose what you need to lose, and you need to keep what you lost, which is very difficult.
Yes.
And the second point, which I think is very important for the audience, is don't look yourself in the mirror because you're used to your body. Just do the numbers. What's your height? What's your weight? And this is science because people don't see themselves as severely obese. Since everyone walking around, is overweight, well, I'm a little bit more overweight than he or she is, but I should be fine. Well, let me tell you, neither he or she nor you are fine. Everyone
Yes.
needs to look after physical activities, calories in, calories out. So this is very important that people understand that the medication alone might not do it when it comes to prevention of cancer.
So now let's go back to cancer. You kind of tied in the three diseases, right? Obesity, diabetes, and cancer. Can we, I mean, is it just the ultra processed food? Is it genetics? I mean, like, or is it just a combination of all? How did we get here?
Let's take one at a time regarding the ultra processed food. I always tell patients I operate on your stomach, not on your brain. And obesity is a complex disease. People don't get heavy because they're lazy. I have good friends of mine that they can eat day and night and they are very, very slim. And I have others, as you will know, that say, well, if I eat a little bit of bread or a little bit more of that, I immediately put on some pounds. Well, why some people have more addiction to carbohydrates than others? Why do some people, do not absorb or metabolize as much energy and calories and accumulate them as fat? All that is multifactorial. It's hormonal. It's a genotype with a phenotype that participate in maintaining an equilibrium, calories in, calories out, because this is like your bank account.
Yes.
If you keep saving every day $5, after 10 years you're going to find yourself that you're a wealthy woman. But if you spend every day $6 and you put in five, you're going to find yourself in a couple of months in trouble because you're going to pay
Yes.
your bills. Well, obesity doesn't, it's not much different. So the problem is that people don't feel that, in the history of humankind, if we go back thousands of years, people lived in caves. They were hunters and gatherers. They walked all day long. We drive. And God forbid when you go to the supermarket and you need to park your car, you will drive 3 times until you can park your car in front of the door because God forbid you got to push this cart. So people walk, use elevators, sit in front of their computers, they get home, they have a heavy meal, and they sit on a couch and watch TV. So there is no physical activity. But thousands of years ago, our ancestors, they had to hunt, they had to fight, they had to spend so much energy to stay alive that immediately there was a balance. Plus, they didn't have a fridge in their caves, okay? They could not hunt and kill a prey and cut it in pieces and put it in the fridge. They had to eat as much as they could. And they would eat probably every 3 days or every 4 days. Whenever the hunger came back, they would have to, again, get into that
Hunting.
hunting. Well, nowadays, to your first point, how did we come to be so heavy worldwide? Because this is not a American problem. There is a
Yes.
pandemic. We are the champs. We are the heaviest on the planet, but it's a world problem. So yeah, processed food, lifestyle, but there is a genetic predisposition. There is a genetic predisposition. There is data showing that those who suffered hunger the most live the longest. And as we get older, and there is data also, and you can share it at some point with the audience if you want to, where I show the telomeres. So our genes are made up of chromosomes, and the chromosomes are made up of telomeres. Telomeres are like little bananas. As we get older, those bananas start shrinking. As we get heavier, those little bananas and telomeres shrink as well. The moment we intervene for people to lose weight, those telomeres start lengthening again. So there seems to be a correlation between aging and mortality and obesity and mortality that links us to those telomere length. And the reasoning is, from a scientific point of view, if our genes keep going short and long and long and short and short and long, that creates instability. And
Okay.
in genetics, we get older and we reproduce by, genetic exchanges and chromosomal activities. If that is unstable, that's when one of those will flip up and become neoplastic and start growing out of control.
Okay.
So the genetics, the genotype plays a role, the predisposition, but the
Yes.
phenotype is also a problem. Our interaction, with the environment, with the society we live in, the jobs we have, our families. It is well known and demonstrated that families of obese parents have obese children. And all you need to do is to operate on one of those. And immediately you will see the whole family getting slimmer because they change their eating habits. Which, by the way, since this is a public podcast, the majority of people we operate on are women. Not because women are the most frequently obese, is because women care about their health.
Yeah.
Men do not. So they walk around with their tummies and they really don't look after themselves, thinking that, they are immortal. But obesity is killing them. Obesity
Yeah.
is a blatantly neglected, ignored disease. And this being said by the World Health Organization.
It is crazy, and it's also sad that it's as you said. I think I really like the point you make. Don't look at the mirror, because if you're comparing yourself with the family and everyone is on the heavier side, you really don't make much of a difference. So instead, look at a number and look at your own personal threshold or cutoff and kind of aim towards that. That's a very valid point, because that's how normalization of your appearance happens, and you're like,
Yep.
it's not that big a deal. Yeah. Yeah, that's so. Let's come back to cancer. And how about men? What is the risk of, you talked about post-menopausal women and cancer risk. How about obese men and cancer risk?
Well, the overall link between obesity disease and cancer is about 42% in the CDC study. 10 years
Hmm.
follow up. This is good data for us to
Hmm.
look at retrospectively. By men, at all ages is about 32% link, which is staggering. Imagine if
Yes.
I can tell you that I get men to lose weight and I decrease their chances of developing cancer by 2%. We're talking about
Yeah.
32%. The two number one cancers in the world are breast and colon cancer. And with
Hmm.
breast cancer, there are over 13 metabolites that are linked to breast cancer and obesity. So it is again staggering that we are not more active on that aspect. But men, are as affected, not as seriously as the postmenopausal women, but they're also significantly affected by obesity, diabetes, and the link to cancer.
And being a cardiologist, I always see a male predominant pattern. Like heart disease is most common in men, diabetes most common. I'm like really surprised and shocked that women are leading the pack here when it comes to postmenopausal obese and cancer relation. That is really unfortunate.
Well, but the good news, Arazi, is that you can do something about it.
Absolutely.
Imagine if I could tell you now that I'm going to decrease the likelihood of postmenopausal women of developing cancer by 40% just by having them take the GLP-1 or getting a sleeve gastrectomy, and although it might be a very small number of those, by changing their lifestyle. I mean,
Yes.
we're starting to understand a little bit more about the implications of our storage of fat in our liver, in our kidneys, in our muscles, in our bones, how that is affecting our health and our genes.
Yes. I mean, like, I think in general, we postmenopausal women also, they kind of, send their kids home, kids off to college, and they think of themselves like, I'm going to relax. And going to relax kind of takes the form of, I'm going to eat whatever I want, I'm going to do whatever I want, I'm not going to exercise, I've worked so hard. And your habits change, and you probably get a little bit more lackadaisical. This postmenopausal depression, the postmenopausal hormonal care is not prevalent in this anywhere. Forget America, even across the world it's not that prevalent. There's so much of uh, things which can be done is not done, unfortunately.
Process starts, however, with pregnancy. Pregnancy is
Yes.
it's a game changer for women, not only because of all the hormonal changes that go through, but there is a significant weight gain
Hmm.
during pregnancy, and not every woman can get rid naturally from that weight. And on top of that, the lifestyle changed dramatically. Lifestyles change
Hmm.
dramatically after you deliver a baby, because you stay home, you are with a baby, you cook all day long for the baby, then you cook for your husband or wife, whatever it is, and then you eat the leftovers. You don't have time to sleep. You don't have, and it's well known that sleep deprivation goes along with obesity. So all those years that women spend not only during pregnancy, but educating their offsprings, affect their lifestyle and affect their weight. So it's something that needs to be controlled and intervened. The sooner the better.
Absolutely. So, have you seen incidents of talked about the study before? But what is the incidence of cancer reduction with weight loss? Is there a correlation with the percentage of weight loss and cancer reduction?
Yeah, there is. If you look at numbers, mortality, morbidity linked to cancer is significantly reduced in populations that are severely obese, that underwent or did not undergo metabolic surgery. And those who until 2024 were hoping to go on a diet and exercise, the amount of weight loss was insignificant and they couldn't keep it down. So, the good thing of bariatric interventions are that they last longer.
Okay.
Nothing lasts forever. I learned that in life nothing lasts forever. But when it comes to maintaining, I would say, a reasonable weight, neither medication nor surgery are 100%. Let's say also that bariatric surgery, despite having been proved to be safe and the most efficacious, it's not perfect. And there are patients
Hmm.
who can have complications, there are patients who can die from it. So, but we take risks every day when we drive our cars to work, and the likelihood of dying from bariatric surgery today is significantly lower than us driving our cars to work every morning. We also get on airplanes and we see planes crashing still in
Yeah.
2024. Rarely, probably insignificant compared the amount of flights, but for that one or two, it is
It is
100%.
devastating,
Yeah.
absolutely. Sometimes I say it in life, you have to choose your shit sandwich, whether you're going to undergo the pain of going through a painful surgery and dealing with whatever comes after the surgery, or you're going to go with and deal with the effects of being obese. And and it's not just a single thing. Your joints hurt, your back hurts, you can't sleep properly because of the sleep apnea. And it's you have to make a choice, and there is no free lunch. You have to pay for the lunch or pay for it one way or the other. And we have to, it's a personal decision. But so many studies showing that children who have seen parents who exercise also exercise. So it's the same thing, right? If you're for each mother and father to make a attempt to change their life, it's extremely important.
Yeah, you know that I have this kind of decision making in the office on a daily basis where the patients say, well, I've been thinking about this for a long time, but I'm concerned, I fear surgery. And I say, well, there is no free ride, you know. I cannot sign you a 100% guarantee that nothing will happen with surgery. One thing I can sign you 100%. Something will happen to your health if you stay obese the way you are. Because if we don't walk 2 miles a day, we put on about 10 pounds a year. So in 10 years, you're 100 pounds overweight and you're considered severely obese.
Yeah.
So to your point, everyone has to choose their Schicksal in life. Yeah, it's unfortunate that some people are put in that situation because of obesity, but it is a reality, and it is a serious disease. It's being not only neglected, ignored, but people don't really understand much about that yet.
So, Dr. Rosenthal, you are in all the major bariatric societies. You are part of the process which makes change come. And you clearly, you've talked almost 30 minutes about just the importance of it. What futuristic changes with regards to the public health perspective can we expect to see with regards to obesity as a treatment policy?
Yeah, it takes time for humans to change their behavior around new ideas or new concepts. Just look at the environmental problems we are having. There are wildfires all over, there are floodings all over. The heat in the Asian Pacific region is going to numbers that people are not going to survive in the next several years, less than a
Yeah.
decade. And we don't change our behavior. We still, throw away disposables and plastic, and we don't change. We don't change as long as it doesn't affect us. And we always read it in the news and thinking that it affects others. But at some point, it's going to touch us. I mean, global warming is touching all of us already. And I think, as Harari likes to say, sugar today is more dangerous than gunpowder. It's killing more people than any wars that you can imagine. It's difficult for humans to change their behavior. And as a society, ASMBS has done a lot, tries to do a lot, but we've been going to the Hill, talking to policymakers. We have a pack that Dr. John Morton initiated. So you invite them to the meetings and you have to write a check so that they come, hoping that if you write a check, they will vote for bariatric surgery being a covered benefit. But it's gonna take time. People are gonna continue to die from cancer, from obesity, and obesity-related disease processes. It's gonna take time. I can tell you that coming back to the revolution of the GLP-1s, while on the one side the volumes of patients that are requesting bariatric surgery has decreased by 30-40%. On the other side, the employers and insurances are starting to say, no, 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 you should not have GLP-1 because they have to pay $15,000 to $20,000 a year for the next 30 years. They say you should go and get bariatric surgery because it's a single shot of $20,000. It's sad, but while on the one side they could not care less if you listen, a major medical insurance was sitting at the table. There was a cardiac surgeon. I was there. We were talking about covering gastric bypass. So I asked this medical director, I said, why would you cover the heart bypass from Dr. So and so and not cover my gastric bypass? So the answer was, if I don't cover his heart bypass, this patient is going to be dead next year. If I don't
Yes.
cover your gastric bypass, it may take a long time. So at that point, the thinking of the insurance was, who cares about their lives? We need to save money. Well, now with the GLP-1, it is a reverse. They still want to save money. They still don't care about the patient. They say, no, don't get the GLP-1. Go to the operating room, get the surgery done because You're going to lose money, and I don't need to pay for you for the GLP-1. So I think that the revolution of medications uh, have a dual effect on us bariatric surgeons. I think bariatric surgery is here, good to go, good to stay. I don't see anytime soon, to your point, what's going to happen. Anytime soon that bariatric surgery will go away. We are still operating on less than 1% of the affected population. So it's not,
Absolutely.
we don't have the manpower to operate on what, 30 million, 25 million Americans. We don't have the manpower. But it's sad that, those who are controlling healthcare live in denial as much as our patients do. They don't understand. And if they understand, they're trying to make decisions based on dollars and cents and not on health and well being. But Arasi is the name of the game that we are involved every day. We know how healthcare organizations act. Novo Nordisk, Eli Lilly are now going to be the $1 trillion enterprises in the world on the valuation. They cannot even keep up with the demand of this medication. But the reason I'm saying this is because they are changing also the perception of society. I would say that if in the next 5 years, I'm not talking about 10, in the next 5 years, these medications are going to be so cheap that everyone can afford it. Why would anyone walk on the street being obese?
Yeah.
That person is going to be perceived as poor, or is going to be perceived as ignorant, or is going to be perceived as someone who could care less about life. Will that individual get a job? Because immediately that individual that comes for an interview, you say, well, how is it possible that you are 50 pounds overweight? Are you taking GLP-1? Why aren't you every morning after you brush your teeth, putting a tab on your tongue? Are you so poor, or you really don't care? Because if I have to pay insurance for you as an employer, I'm not willing to do that. So all this is having a social implication also, that it wasn't a problem until recently, because we surgeons cannot operate on all people that are affected by the obesity disease. And it is surgery. We need to acknowledge that. People fear surgery. But the denial is over.
Yes, yes. I think that's what GLP-1 did, right? It made everyone aware that now it could be a choice. Yes, we are still limited by insurance company, etc. right now. But in the future, if you are overweight or in the obese category, you are making a choice to be that way and you're not doing what needed to be done. It could, I almost come across like you're being irresponsible. You don't, you're pursuing a behavior which is not compatible with, you know, yes, reckless. That's the right word.
There is a nice article coming out in Sword. I asked our pediatricians and pediatric surgeons to put together a whole um, open access issue on management of obesity in adolescents. I'm not suggesting now that adolescents should have bariatric surgery, but I wanted to know from a scientific point of view if it's safe to give kids GLP-1s. And you say, oh, come on, Raul. Are you serious? Well, I'm serious because the degrees of obesity that you see in childhood in America have never been seen before worldwide. And although these kids might smile and eat cake and they look adorable, these kids are suffering. These kids have personality disorders because they feel different. They feel they cannot run, they cannot compete. They're sometimes subject of being bullied. So I think this medication is a blessing for society.
This point about pediatric obesity is so timely for me right now because I was on call this past weekend and I was called to put ECMO, the kind of a life support for a 16-year-old who weighed 112 kilograms. And that weight was a cutoff for the pediatric cardiologist and the pediatric surgeon. They're like, we are not comfortable operating on someone who's this big. And so they came to the adult side, and it was really kind of terrible and sad to, and I'm not a pediatrician, I'm an adult cardiologist, but we had to do it because this person, this child, was not in a child's body. She was stuck in an adult body size. And, she's still struggling for her life right now. But nevertheless, it's so much common. And with social media and everyone telling you, that's the part about social media, which is extremely annoying. They have made weight into a conformity. Like, this is how you need to look, instead of making it about health and, get up and move and be active, enjoy a life by being active and healthy. They've made it about looking a particular way, which is extremely annoying. And I'm sure it's very traumatic growing up as a child who looks different from the social norms. So that'll be a curious data. So are your friends working on that paper right now for you?
Oh yes, it's going to be a whole issue, and sort on management of obesity in adolescents.
Yes, yes,
They're still in a developmental stage, so you have to
yes,
be careful, what you do with medical interventions or surgical interventions, calcium absorption, bone development, etc., etc. But to your point, when you are 250 pounds at age 15, you're not a child anymore, and you should
yeah.
not be worried about your growth. You should be worried about survival.
Yes, absolutely. And I mean, I think the data on obesity in children, I think, is very limited compared to what it is in adults. Do they grow up? Do they change behavior? What is the role of incidence of cancer in those patients? I think instead of us, and there's so much talk about longevity in this world. Everyone is talking about, oh, longevity clinic and this and that, and something so obvious, which can be fixable with better education and awareness in schools. We are not targeting it at all. We are just leaving it uncovered. Anyways,
Here we go. Just get rid of obesity, and we all are going to live longer.
true. Absolutely right, because it reduces heart disease, it decreases diabetes,
In
stroke.
front of you.
Yes, yes, yes. Rahul, thank you so much for this fantastic conversation. I have learned so much. It has been fabulous. It's been an absolute pleasure talking to you. And I'm going to look forward to that paper in Sword. And I'll put the link of the Sword down in the show notes page. And also some of the data which you have talked about, I'll put that as well. Thank you so much.
Thank you so much for listening. If you found us valuable, you can subscribe to the show on Apple Podcasts, Spotify, or any of your favorite podcast app. And also, please consider leaving us a rating or a review, as that helps others find the podcast too. I hope you have a great week ahead.